My name is Terry Brown, and I'm the medical director of the St. Joseph Memorial Hospital Sleep Disorders Center, both in Murfreesboro and the one in Marion. Well, if it's primary insomnia, you want to regularize their sleep schedule. You don't want them going to bed at 3 a.m. one night and 11 p.m. the next night. You want to regularize their going to bed and getting up times. Often we'll have them complete sleep diaries just to kind of get an idea of when they really are sleeping, if we can't really deduce that from talking to them in person. And then once we find that out, it depends. You know, like in some cases, I remember one lady who would spend 8 hours in bed but would only sleep 4 of that 8 hours. So usually if people, in other words, she's sleeping 50% of the time essentially that she's in bed. So 4 hours is probably not enough for most people, but on the other hand, she's probably spending a little too much time in bed too. We would ask such people, you know, well, before you developed this problem, how many hours do you think you slept in bed? And, you know, if they said 6 or whatever, then we might reduce the amount of time they stay in bed to 6 and see if their sleep starts to fill up more of that 6-hour period than it did the 8-hour period. So that's a technique that's called sleep restriction, although it probably should be called time in bed restriction more properly. So that's one treatment. Of course, we use sleeping pills in some cases. We like to rule out sleep apnea before we give sleeping pills because the sleeping pills might make sleep apnea a little bit worse. And then those are pretty much the usual treatments for insomnia. There are some experimental treatments, but those are the ones that are available right now, medication and what we call cognitive behavioral therapy. And sleep restriction is one example of that, but also what you tell yourself when you wake up in the middle of the night can be really important. You know, if you catastrophize, and you know, I had one patient one time that told me, I said, well, I was trying to explore that, and I said, well, what would happen if you didn't sleep? You know, and he says, well, then I have to go to work really sleepy, and then I might make a mistake at work, and then I might get fired, and then my wife might divorce me, and then the Mormon church might disfellowship me. So this guy had a chain of anxiety links all connected to that, which needed to be questioned. And so part of the therapy was arranging for him to give himself a different script when he woke up in the middle of the night and think to himself, for example, hey, I'm awake now, but you know what? If I don't sleep too well tonight, I'll probably sleep better tomorrow night. So we were just kind of working on what he actually tells himself that could actually be making the problem worse. So that's the cognitive part of it.